It's my pleasure to Dr. Thomas Laudone, who grew up in New Jersey and graduated with his PharmD from MCPHS University in Boston, Massachusetts. He returned to New Jersey to complete his postgraduate year one training at St. Joseph's University Medical Center in Patterson, New Jersey. He then went on to complete a PGY2 in pediatrics at University of North Carolina Medical Center in Chapel Hill. He currently practices as a board-certified pediatric clinical pharmacy specialist in the pediatric emergency department at the University of Maryland Medical Center. His professional interests include everything PEM related, emergency preparedness, academia, and global health. So I'll turn it over to him. Thanks.
All right. Can everyone hear me? Okay. Thank you, Sandeep, for that introduction. Good afternoon, everyone. I'm excited to close out today's great day of presentations by talking to you about some tips and tricks of being a new preceptor. I know for some of you that might be a little bit down the road. I know for some of you you're already in that, or you're very much into practice and that was a long time ago, but I hope for this to be applicable to everyone depending on where they are in their training or their practice. So I just wanted to start off before going into the slides. If people can kind of share what some of your concerns are or challenges that you anticipate with becoming a new preceptor or starting a new practice once you finish residency or fellowship training. And then for those preceptors in the room, what were some of your greatest challenges or barriers for when you started your practice or started precepting learners? So if people want to just kind of share some of those things. I know it's a little bit down the road for some, but I know I was worrying about things way in advance as well. So, and I can kind of look at the chat as well to see if there's other. Yes.
I think one thing that is kind of scary about becoming a new preceptor is just like the self-doubt of not knowing if you know enough to teach, a learner.
Great, thank you. Another minute. Yep.
I was worried that people wouldn't take me seriously because I had just finished and like therapies where I wanted to go, I'm only 1 year of training ahead of them.
There's one in the chat, so the precepting trainees that are older than you.
Oh yeah.
I think one thing that a lot of us are guilty of, and I've witnessed other people guilty of too, is you tend to be the hardest preceptor your first year out of residency because you have these sometimes unrealistic expectations for yourself when you're a resident, and then you sort of extrapolate that onto the learner that you're precepting.
Absolutely.
Knowing how to give constructive feedback or actionable feedback.
All right. I guess I'll hand over there. Yep.
Precepting students that I've known either from pharmacy school or being from a small town that I've grown up with and having to navigate that new dynamic.
Absolutely. Is there another hand? Yes.
Something I had during my PGY1 is the student rotations were longer than the resident rotation. So I had a couple rotations that I was precepting students that had been on the service for longer than me. So they knew more about kind of logistical stuff that I didn't know. And it was kind of weird having to ask the student to explain to me where the bathroom is on this unit and things like that.
Yeah, definitely.
Having to create a rotation schedule.
All right. Any last challenges anyone wants to throw out? All right. Great. So thank you for throwing some of these challenges out. I myself had a lot of the same ones. Sorry. There's I had a lot of the same ones, so I definitely can resonate with you. I am one of the people who went to a 6-year program, so for the first 2 years of being a preceptor, almost all of my students and learners were older than me, so I definitely can relate to some of those challenges. And so my hope for the rest of this presentation is to address a lot of these challenges, and we'll come back to them at the end to talk through some of the things we can do to kind of counteract these challenges as we either step into being a new preceptor or if we've been precepting for a while and we feel like there's still areas of improvement, because we're constantly growing and learning. So I'm just going to move this out of the way so that this side can see. Come back. All right. So before jumping into precepting specifically, I think it's really important to talk about how you need to be established in your clinical practice setting first. So you can't have a great rotation for a learner to come to if you're not actually part of the team or have a pretty significant presence there. It's going to be really hard to teach that learner and kind of model for them what a pharmacist does in that specific environment. So just to give you background, as Sandeep said, I work in the pediatric emergency department at University of Maryland Medical Center. There was no pharmacist before me. And so I had the excitement and pleasure of kind of starting clinical pharmacy services in that area within the hospital. So a lot of what I talk about, I'll be kind of referencing back to a lot of my own experiences doing that. So starting out, we're going to work through the good, the bad, and the fun of being a new preceptor. So the good. So I think a lot of times we think of, what worries us the most, as we listed here, there's a lot of things that give us anxiety. And we want to do a good job. We want to really provide great care for our patients, but then also produce really great learning environments. So, but there are a lot of exciting things about being a new clinician to an area, as well as a preceptor. And so starting from the bottom, autonomy and independence. So this is really great. You go from being a resident or a fellow where your whole year is kind of scripted and you have a very clear schedule and deadlines and everything. And then you just all of a sudden start in a practice setting where no one's really necessarily saying this is your deadline or you need to get this done or you have a year to finish it. And so there's a lot of independence and autonomy. And I like to view that as a really good thing. I struggled with it in the beginning because I was like, wow, I have all this time and I have all these things I want to do. How do I make it happen? But I really viewed it as a positive in terms of making my own hours. So when I started, I was doing a day shift and it just really wasn't that busy in the morning. And so I met with the medical director of the unit, the nursing leadership and pharmacy leadership. And we decided, okay, maybe later on in the day hours makes more sense for the pediatric emergency department because that's when a lot of the volume comes. So I started out not really doing what was best for the unit, but then I was able to shift over the course of a couple months to have a better shift where I'm there for majority of the patient care, but it also doesn't compromise my personal life of having to work always like a weird 2 to 10 p.m. shift. So definitely something that can be a little bit strange because you go from a very structured year to all of a sudden kind of being able to figure it out on your own. And especially if it's a new service, if there was no pharmacist there before you, it's really a blank slate, which is what my case was. There was no one I could ask and be like, so what did you do during this downtime? Or what did you do when you had this and stuff like that? How did you manage it? There was really not, someone who had practiced in that specific area that I could bounce those ideas off of. Next is advocacy and a pharmacy liaison. So I think this is extremely important as pharmacists because especially on a unit where there was no pharmacist before, that unit probably doesn't have a huge voice in the grand scheme of the hospital, right? So I came to find there was all these things that the pediatric emergency department was struggling with from an operational, just getting things out of the Pyxis or not, but they never really knew who to contact from pharmacy, right? So they would send an email, they weren't sure, they got bounced around and they would say, we'll just live with it, right? So I feel a big part of what I've been able to do on the unit is really be a voice for the department. So whether it's bringing things to Pharmacy and Therapeutics Committee, bringing guidelines, policies through, raising things to the manager. One simple thing is they had an issue with we give meds to go when patients are getting discharged for patients that don't have insurance. And they were overriding the inpatient medications because the system wasn't restocking. All it took for me to do was send an email to our manager saying, hey, there's something wrong. And it was fixed within a couple hours, if that. And they automatically, oh, thanks so much for helping us out. So something that seems like a big thing to the unit might be something very small that you can fix and really start building that rapport. So I think that's a really great aspect that you have in that role. And ultimately, all of these things are going to lead to improved patient care. So, we're wanting to start and expanding clinical pharmacy services to improve patient care, to be present, to be speaking to the teams, helping manage patients. And then ultimately, once we've established that, we can then bring in learners to start modeling, this is what a pharmacist looks like in this specific clinical specialty area. And really just ultimately continue to improve patient care and continue to train the future pharmacists that will be taking care of these patients. So that is what I call the good. And now moving into the bad, but quote unquote challenges. So I think some of these things tie a little bit into what I want to focus on this slide. So I would say at the top is really the main structure point here. So rapport, and all these things kind of follow suit. So I think, let's see, one of them was like not taken seriously, and like self-doubt, like, am I ready? Am I qualified to be in this position? And I definitely felt that too. I remember, you know, the weekend in between moving here and getting ready to start my job, I was like, I'm going to be the peds ED pharmacist. Like, am I qualified for that? Am I ready for that? And so, you know, you need to have confidence in yourself so that when you go into those environments, you can build that rapport and be confident. And the rapport goes a long way. For me personally, in the emergency department, I identified what the heartbeat of the department was, which is the nursing staff. The residents always change, the attendings change, people are in and out, but there's a lot of nurses that have been there for 20 plus years. And so I really just went out of my way to get to know them better, get to figure out what their needs were. And they wound up advocating for me, and I didn't even have to. Like, they got a computer designated for me right next to the attending. I didn't even have to ask for it. They're like, you should be part of our team and be right in the middle. So just kind of figuring out that, you know, who are those people that are really part of that unit, and how can you build those relationships with them, and they will advocate and do things for you. I got a nurse appreciation gift during Nurse Appreciation Week because I would help bring blankets to patients and water and stuff like that. So just being able to, you know, be comfortable going a little bit out of the scope of a pharmacist to help the unit when it's somewhat on fire and people are running out like crazy. Like, how can you help? You know, yes, we're all about medications, but I can go get tubing, or I can get blankets or whatever during a code. So if that's what's needed at that moment. So I think the rapport really fits. Everything kind of comes after that. So department culture, especially if you're in an area where there was no pharmacist before, they've been doing life without a pharmacist for insert however many years, right? So you're not going to necessarily come in and be like, we're going to change this, and then they're going to be like, who is this person? Like, who is this guy thinking he's just going to change everything? So I think it's really important to understand and just kind of observe in the first couple of weeks or months to figure out, how do they do things? Like, what is a more concerning thing versus a not more concerning thing? So for example, I was like, they're overriding inpatient medications and giving them to patients. Like, that is not okay. That's probably illegal. So we need to address that very quickly. And whereas something else where it's like, okay, how they label a medication or something like that, there might be a better way to do it, but they're not doing it wrong per se. So just really figuring out what the culture is there, and then having the mindset, you're not going to fix everything that's really alarming and scary to you in one day. It's going to take time, and you're going to have to kind of see where you fit into that culture. Going back to some of those concerns like self-confidence or self-trust, and then not being taken seriously. So yeah, like you want the team to trust you, right? You want them to go to you and ask your opinion. You want to be able to make recommendations and them trust you. And so I think this really comes in with being confident. Like, you know a lot more from residency training than you do, and you don't really truly get to see that until you're on your own in a setting where you can't turn to your preceptor and say, hey, you know, what is this? Of course, we have, you know, great coworkers and colleagues where you can bounce things off, but there's some times where you're like, okay, I remember learning about this. I remember talking to my preceptor about it. Like, I got this, we'll figure it out, or I have to look this up. So whether that means, you know, you have folders where you keep a bunch of articles that you might have to go back to and reference here and there, or just staying up to date on the current literature. My greatest fear is that an attending will turn to me and say, hey, what do you think of this new article that came out? Like, do you think we should implement in our ED? And you're like, I haven't read it. I don't know what you're talking about, right? So just making sure you're staying on top, and you're gonna be fine. You're gonna be able to be on top of the newest data and be able to implement it in your practice. And then lastly, being the go-to person, which we'll kind of go into a little bit later with like some, you know, managing being a preceptor and a clinician. Once they gain that trust, it's like a bond. Like, I think after 6 months, I was like, wow, I feel like I've been here for way longer than 6 months. And then they're like, I don't only trust you, I don't trust any other pharmacists. I'm like, that's not good. Like, you should trust other pharmacists. But it's crazy how quickly it goes from, oh my gosh, who's this guy who's like standing on the computer on a computer on wheels trying to intervene, to like, we need your help with this. Like, what do you think? Like, I want you involved. So it's kind of a little bit of a culture shock, and just knowing, you know, that you've gotten to that point, and then continue to like harvest that and develop that. But being careful that you don't burn out, which is what I'm going to really focus on later, because I think that's what can happen is you want to be, you want to be that person. You want to be that, go-to pharmacist for your team, but you can't do that 24/7, 365 days a year. It's just not feasible. So just figuring out ways to, kind of balance being that go-to person. Next, we'll talk about the fun of being a new clinician / preceptor. So this is really where I think as learners and as preceptors, there's a lot that we can do collectively going forward. I think a lot of these things really focus on the burnout that I was talking about and helping prevent that. I think, within the first 2 years, I've definitely felt degrees of burnout. Sandeep and I have had many great conversations about balancing them. And so these are some tips and just experiences that I want to share that have been really helpful to kind of balance being a new preceptor with also being a new clinician and everything that comes with that. And so first off, we are going to start with preceptor engagement. So some of you guys may recognize this lovely group. These are my awesome pediatric clinical pharmacist coworkers. And so the thing is you're never truly on your own, right? So yes, I'm the only pediatric emergency medicine pharmacist at the hospital, but I have a whole group of pediatric pharmacists who have all gone through training and have had a wide range of experiences. And so that's who I lean on to. I also made an effort of contacting Hopkins as well as Children's National, their emergency department pharmacists, and just meeting with them and talking to them about like, what do you guys do? How does this work? And so they're not direct coworkers or preceptors with me, but I can still have that rapport with them that I can reach out to them and bounce something off of them or collaborate with them on something. So this though is our group. And so these are just a very small handful of pictures of some of the things that we've done. We've done a lot, but I moved to Baltimore in July of 2020, which was the height of the pandemic. And so my life pretty much consisted of going from home to the medical center and back. And so for like a year and a half almost. And so it was hard. Like, I feel like I knew the nurses and the physicians, but I didn't feel like I knew my like pharmacist coworkers that well. The people I shared an office with or attended meetings to, everything was virtual. I had only been here once for my interview. And so I decided to kind of change that. And so just having our group already meeted often and hung out and stuff like that, but just made it a point of like trying to get get-togethers and get to know them outside of work, not just inside the walls of the hospital where it's like all patient care and everything. Like everyone has a life, and just acknowledging how they intertwine both professionally and personally, I think is very, very important. So this was at our resident celebration this past year. The bottom picture, the middle picture, we went to a Capitals game in DC and got dinner together beforehand. And then the last picture was our residents graduation dinner / happy hour that we had. So it was just great because I felt like even though I wasn't necessarily maybe like fully engaged and meeting everyone at the medical center, I was still able to make a really close knit relationship with the pediatric pharmacist. And so just being intentional about that. And I know it's awkward and asking people to hang out and coordinate things, but I promise you, you're probably not the only one who's feeling that way. Like there's probably other people who are new to the city or haven't gotten connected and would love to go get drinks and whatever to just kind of catch up and do that. So definitely encourage that. It's made a huge difference. We're a very close group. And I think this is a big part of it, is just having that preceptor engagement. And so the other thing I want to point out about these photos is that our current resident is in one of them, but also our old resident. So we also included the resident in what we were doing. It wasn't exclusive, like we're going to just be a preceptor group and it's us versus them. Treat them like colleagues, like you're all going, you're all taking care of the same patient population. And so our resident Irene was a part of all these outings, and we got to know her so much better. And it never made things awkward or challenging within like precepting her. If anything, it made it easier because there was that level of trust, and she knew who you were outside of work and in work. And, she was able to be more transparent and give more honest feedback. So I think it's really important to just, also include the learner, whether it's a resident or fellow, in those experiences. I know a lot of preceptors take out their students on their last day of rotation to lunch. That's an awesome thing. I've had preceptors do that to me. I still remember it. I want to do it for my students. It goes a long way. It means that, you enjoyed having them on rotation, and you want to just, pay it forward and do something that someone else has done for you. So I encourage all of those engagement methods. Next is talking a little bit more about how to engage the resident and the student, right? So professional and personal goals. So I know some people talked about the age difference and whatnot. I feel you on that. I was like, this person's 2 years older than me, but I'm like the knowledgeable one, and like I need to be the one that knows everything, right? And I think it's okay to just be transparent and honest, and you should develop a point where, you can say like, this is, I'm a newer preceptor. I would definitely like you to give me feedback at the end so that I can improve and get better. And so personally, what I do with all my learners is on the very first day, I ask them to think about both professional and personal goals. So I, of course, want them to be working towards whatever their goals are in their career. But I also want to just make sure that if they, have a wedding coming up, that I know about that. Like, that's a big thing, right? So like, you could have a learner on rotation with you for a whole month and you have no idea they're getting married the next month. Like that, I don't know, that just doesn't sit well with me. So I think it's important to just know what's going on in their life, or in that things happen. Like, you were just in that spot. They might have a family member that's sick and they're balancing that. And so just being aware of it, you don't need to know all the details, but just kind of knowing that there's stuff going on, you can better precept that learner. And learners, I challenge you to do the same, just to kind of ask, like, bring it up. It might be awkward, but just have that conversation with your preceptor on the first day. Like, hey, like, these are my professional goals, but I also want to, focus on this, or I'm hoping to, do this outside of work, and just make that a known thing, and kind of break that notion that we can't cross those barriers. Because I think that's another big thing that contributes to both preceptor and learner breakout, is it's just like constant work, and not talking about what's going on in people's lives. And so, I think it's just really important to balance both of those things. Also, just being realistic with your learner and their level of learning for their goals. So my area is very, very specific. It's pediatrics, but then it's emergency medicine. So that's not going to be for every learner, right? And so it's important to make sure that you're setting realistic goals, or SMART goals is the acronym I like to use. So specific, measurable, attainable, relevant, and timely. That will allow that student to flourish. So if they're not going to become a pediatric clinical pharmacist, they probably don't need to know every single ins and outs of the pediatric disease states, but maybe they want to focus on working up patients or written communication. So just saying, okay, we're like, in the context of the emergency department, we're really going to work on those skills so that when you go to other rotations, you feel confident in them. So I think just talking through those goals up front and early on is important, and then having regular check back in with that learner to make sure that they're meeting those goals. And if you have to adjust, then you can adjust. All right, so now that I talked about really establishing yourself in the position first and getting into engagement, next comes actually precepting, right? So you've just established yourself in your new service, whether it's a brand new service and there was never a pharmacist there before, or if it's a service that you're taking someone's position, it's still going to come with growing pains and figuring things out. So thankfully, most places will give like a 6-month grace period where you're not allowed to have learners up front. But before you know it, they're going to be there. Whether it's the school of pharmacy asking or other people asking, they're going to be looking for you to have learners. And so it's going to come quickly. And so up front, you might feel like the weight of precepting sometimes outweighs the balance of still maintaining your clinical responsibilities as well as administrative duties, right? So some of the things that I kind of encountered early on when I was precepting after just establishing the service were these things here on the side. So level of learner. So this was challenging in the beginning because I actually was assigned to IPE students, and my rotation is really geared heavily clinically. It's not as much operational institutional based, which is what the requirements are for IPE students. And so that was challenging. That was really hard to figure out how I can take this rotation and make that advantageous for the learner who's in a very different level of learning that I would consider my practice site to be best for. And so that was challenging up front. And then confidence. So we talked about that a little bit. You were just a resident, and now 4 to 6 weeks, depending on how much time you take off between training and your new job, you're being asked to kind of be the person. And then 6 months later, you're being asked to precept and teach people that might be older than you or might be a year behind you in school that or have worked with. And so how do you make that you know, kind of build that relationship that you can teach them and that they trust you and respect you. And so I think for me personally, when I was in residency training, I kept folders for pretty much every disease state, and I compiled articles and stuff. So when I'd be going into a topic discussion, I would have to maybe reread like an article or a guideline or something like that, just to kind of refresh my memory and make sure that I, you know, am conveying the correct information to that learner. And so it's okay to go back. You're not going to remember every single thing from residency training, but it's important to know where to go to find that information. And then when you start doing those topic discussions over and over again, it really cements that. I remember being a resident and some of my preceptors, I'd be like, wow, like one day I want to know as much as they know and I want to get there. And I'm like, how does that happen? And I'm starting to see it a lot more, only being 2 years into practice with repetition and just staying up to date on literature. Like you get there and you're constantly talking about it with the team. And you know, you do the same thing. Like residency, it's month to month, right? Or fellowship month to month, where you are in one area and then you get plucked away and you're in another area. So it's kind of hard to maybe stay with that. Whereas a lot of these preceptors are, you know, have been doing that specific area of their specialty for a long time. And so it becomes repetitious and they get more confident with it. And so you will get there. So, you know, don't be discouraged if you know, feel like you're not providing the learner their best thing, which brings me into my next point, which is feedback. So I won't talk a lot about it because we had a whole lecture on it earlier, which was awesome. And I just want to echo that it's so important. Feedback is absolutely crucial, both feedback from you to the learner and the learner back to you, right? So when I had my first resident on rotation with me, we did the wrap up and I said, like, look, like, I don't think this was a secret. Like you were my first learner and, you know, because she knew the group and whatnot. And I asked her, like, what can I do better for like future students or residents? Like, what did you like about the rotation that was structured well? What did you not like about the rotation? I got feedback on the schedule. So like, how do you make a schedule, right? Or the syllabus and things like that. And then you can take those and go to your fellow preceptor. So my emergency medicine preceptor and the emergency medicine preceptor and the PICU preceptor gave me examples of their syllabus and like what their schedules look like. And so I was able to kind of take those and make that into my own that makes sense for my rotation based on the feedback that resident gave me. Additionally, self-reflection I think is really important. We probably don't do enough of this. I like in the previous presentation, the slide about like taking a second to just like stop and look in the mirror. I think we're in go mode and we need to do this more often and just say, okay, like that was a month that just flew by. Like, how did it go? Like, did I feel like the resident or the learner did well, or do I feel like they were struggling throughout? Did I have to adapt my teaching style better? And just asking like some of your coworkers too. So a lot of times we'll do topic discussions or we'll have conversations and your coworker might pick up on something like, hey, your student you weren't seeing, but they looked like completely lost when you were talking about this disease state, right? So just seeking out that input from others and also just looking in the mirror yourself and you know, self-evaluation. Self-evaluation is really hard, but very crucial for improving and getting better as a preceptor and a clinician. And so a little bit later on, I will talk about how we balance the scale and some tips and tricks that I use to allow myself to be equally balanced with both precepting as well as being a clinician. So I would be remiss if I did not talk about virtual precepting. I'm sure that a lot of people have experienced virtual precepting. I'm sure you guys have attended a lot of lectures on that. So for the people in the audience, what were some of for those of you who were on the learner side of it, or those of you who were on the preceptor side of it, just a couple things that were really challenging for you as a preceptor or a learner during virtual precepting? Yes.
I think it was kind of hard to develop that relationship often with your preceptor because you're only seeing them, you know, maybe a few times a day, just sitting on meetings and just not having that like true face-to-face.
Yep, absolutely.
I was gonna say something similar.
Okay.
Mine was like more of like developing beyond the preceptor relationship with the medical team. Like being virtual is really hard to break through with like physicians and nursing staff.
Yeah, absolutely. Yeah. So you don't have that FaceTime that you would normally have if they were with you 8 hours a day or whatever the rotation requirement is, rounds and everything. That's all cut out, right? So I know some units would get an iPad and they walk around with that, and you'd be able to kind of interact with the team in that capacity. That's challenging though. It's just not the same as walking up to someone and having that conversation. And also, using things like we have a secure messaging chat. I know some places have like Epic messaging and stuff. So there are ways around it, but it's just not the same as building rapport with the team when you're in person. So there are a lot of challenges in that. And so I think of my IPI student, who not only was I having an IPI student as one of my first learners as a new preceptor, but it was virtual. So the student wasn't even allowed to be in the hospital until the very end of my rotation because of the restrictions we had. And so I was just like sitting there scratching my head, trying to figure out like how I was going to make this, a meaningful rotation. And so what did I do? I asked my coworkers, right? And one of them suggested, a lot of times they can do like work with the med safety team and they can shadow in this pharmacy. And they had this whole thing that they do with IPI students at baseline. And so I didn't have to go and recreate the wheel. I was able to just reach out to those people and be like, hey, is there a med error that my student can work on and help you with? In terms of engagement with the team, I had him do a in-service. So I gave him something that I noticed to be an issue within the nursing staff and the ED. I gave that to him, he worked on it, and then he presented it as an in-service to the team. So although he wasn't like physically there all the time, he still had interaction with the nursing staff. So you're not preventing that learner or they're not void completely of being able to interact with other healthcare professionals. There are creative ways that you can get them involved. And then the other thing is when they did come back on site, just being mindful of that, you might be used to the environment and you might be comfortable in it, but every person has different levels of comfort. And so I had one learner who was actually just shadowing me during the pandemic, and I could tell that this student was like a little apprehensive about being in the ED. It just looked like they were very uncomfortable. And so I asked them, I was like, is everything okay? Like, is there something that's bothering you? Like, do you want to talk about it? And they were like, well, I actually just had a baby and I'm really nervous about being in the emergency department right now and potentially getting COVID. And I was like, whoa, like that's a big thing that they were kind of afraid to share with me. But it was really important for me to know. So then I was able to adjust what that shadow day looked like and made sure that that individual was comfortable, but still getting something out of that shadowing experience. So just being mindful that people, I'm not maybe as nervous about being in those close contact, and I don't have those additional things outside that might be scary, but other people might be in a different place. So I could talk a lot more about virtual precepting, and there's a lot of great lectures that have been done since this has been a big barrier to our learning, but I did want to touch on it during this presentation. All right, next, talking about the transition from resident to preceptor, right? Or resident to clinician. And so, as I mentioned, you go from being a resident or a fellow for 1 to 2 years, and then all of a sudden you're the person. You're on the service, it's your service, and you need to be, that person, right? So a couple things I want to talk about how to make that transition a good one and a positive one that I'm also still working through 2 years in is work-life balance, staying organized, and that 1 year timeline no longer exists. So starting off with work-life balance, once again, this is extremely important. Probably one of the more important things is maintaining work-life balance, because burnout is at an all-time low. If you read through any of the pharmacy journals that are out, there's probably at least 1 to 2 articles about combating burnout in pharmacy learners and pharmacists and pharmacy preceptors. It's all over the place because it's really real right now, especially in the setting of the pandemic. And so having that work-life balance is so crucial. I think my biggest piece of advice is protect your time. So this is something that it took me a long time to get used to and do. So I went a long time without taking PTO because I was so afraid that if I wasn't there for the team, that they were gonna, crash and crumble and they were gonna lose all the trust they had in me because I wasn't on the unit for a day, right? And that's not healthy and that's not possible. And so it took me a long time with meeting with mentors and coworkers to figure out, how do I sustain the service while I'm not there? And so it's still a work in progress, but I think I've grown a lot in that and taking PTO and making sure that I have that protected time. Or if you have a learner on rotation with you, obviously you want to be present for them. But if you have to take a day off, so if you have, a doctor's appointment or you have a wedding to go to and you can't, you have to take that time off, figuring out a way that that learner can still be on rotation and have a meaningful day of learning, right? So it shouldn't preclude you from taking a day off, but just making sure that you're setting up something for them to work on at home, or they're going to spend time with a different pharmacist that day, whatever it is, just making sure that they still have that. So work-life balance for me is a lot of different things. So I'm a huge Mets fan from New York. They're probably going to go to the World Series this year, hopefully. So sorry, Orioles fans, but huge Mets fan. So during the season, I like put the game on in the background at home. So if I am doing something at home or I'm driving home, it's like the first thing that goes on in my car is like the Mets game, because it's just relaxing as kind of background noise to listen to and exciting when they do well. I do have a cat named Olive. So when I first moved here, I was living by myself and didn't know anybody. But thankfully I had her. And so it made things a little bit better until I got more plugged in with preceptors and other friends in the city. Traveling. So traveling for me was really big. This was actually like one of the first trips I took after I had a conversation with Sandeep about taking more time and whatnot for myself. And so this is out in Colorado. Yeah, it was great. Just getting out of the city and doing something fun and not being able to travel for a long time too. Like traveling is something that is really important to me and fun for me. So just making sure you do that. And then I'm a big foodie, so I love eating all sorts of things. So whether it's, hanging out with friends, family, whatever it is, make sure you're enjoying. Baltimore has a lot of great, we were talking about what do people think about in Baltimore, but there's a lot of great food in Baltimore, and like every neighborhood has like a different pocket and a different kind of food. So definitely don't pass up on that. If you're like only going to be here for a year or two, make sure you really dive into that. So next, talking about balancing the scale, right? So we've talked a lot about what the challenges are, how to foresee things that are going to come up, but how do we really balance that scale of being a great preceptor, especially if you're a new preceptor, with also managing your clinical and administrative duties. So the two big things I want to talk about are flexibility and time management. So I think flexibility is crucial. A mentor of mine once shared, like, never have more than 80% on your plate, because you want to be able to, if something comes in the way, you want to be able to just take that in stride and not feel like you're over 100%, right? So your limits, your boundaries. So just make sure you don't have too much on your plate, where if someone comes and slaps a project on your desk or slaps a presentation, that you're not like already at your breaking point and then can't handle that. So being flexible and adaptable is extremely important. And then time management, organizational skills. So I think something that's helped me a ton is that aspect of it, is really just continuing to grow and managing, okay, what are my precepting responsibilities? What are my clinical and administrative responsibilities? How do they intertwine? Can I, have a learner help me with this project and then take that project to P&T? And okay, it's a great experience for them, but it's also something that I needed to get done for the emergency department. So how can we intertwine those? And so some personal examples to share with you in regards to staying organized. So this is an Excel sheet. It might look a little crazy or neurotic to you at first, but let me explain it. So when I first started, it was the pandemic. The patient numbers were very low, and I wanted to make sure that I was keeping track of everything that I was working on. So if anyone, my manager or coworker, ever was like, hey, I noticed there's been like only like 8 to 10 patients every day. Like, what are you doing with your free time? Or what are you doing? I was able to be like, okay, well, I took care of patients from, like I did 6 hours of patient care today. I had 2 hours of meetings, or I worked on this project. And so I started this on day one, and I do it to this day. I have a whole Excel sheet where I keep my personal time log. And so the day of the week, what hours I was there. So I don't actually like swipe in and out. So I keep track of the hours that I work. If anyone ever was like, oh, did you leave earlier this year? I was like, oh, I was here until 7:31. So it's like even down to the minute. And so how many patients I've seen that day. So how many patients came within that 11 to I work 11 to 7:30. So how many came within that time frame, the meetings I went to, and then I keep track of the notes that I wrote. So pharmacokinetic notes or patient counseling, medication histories, whatever it is. And that helps for a lot of reasons, because For the school, I have to keep track of these things and report them weekly, and then that goes into my annual evaluation, and then also just kind of like having a portfolio put together. And for me, I'm new to the service. It's been 2 years, but I'm thinking ahead already. I would love to expand pharmacy services in the emergency department, right? And have more coverage. And the nurses are constantly asking, like, can we have another pharmacist and whatnot? And so when that time comes, I want to be prepared and know how to write a proposal, right? So like, these are all the committees I serve on. These are all the meetings I go to. These are all the things that take me away from patient care potentially that I need to use to get back, and figure out how to balance those two, plus add a learner on that, all of those things on top, that's a lot, right? And so when that time comes, I want to be prepared to be like, this is how I envision having 2 pharmacists on the service, how we would divide and conquer. And then lastly is project or some sort of organizational tool. So for me personally, I use OneNote. So this is just one screenshot of my OneNote. I have overall PZD. It should probably just say PZD, not projects, but and then I have a tab for each thing. So I keep track of every single learner I have on rotation. So fellows, residents, students, a medical student. I have a medical student coming up on rotation with me soon. So whatever it is, learners, ED information. So that's just like who the medical director is, who the clinical lead nurse is, and stuff like that. So things that you'll eventually just memorize, but I didn't know up front, or like people's phone numbers and stuff, like their extensions. Then I have a to-do list, my accomplished list, project ideas, and current order sets. So like you'll have that idea and you'll be like, oh, I really want to like not forget this. So that's where I would write that in here. And then I can go back to it when the time comes to submit research projects or submit MUEs and stuff like that. So this is just one example of like a lot of the projects that I've worked on since I started in 2020 and up until now. And this is also really helpful for those of you who have had to recently update your CV. You know how much of a brutal process that is, because you are trying to remember like all the things you gave, all the presentations you gave, all the things that you did in the last like 2 years. I can barely remember like a week ago what I did. So this is really helpful because I can just go back and click through all my presentations. I can click through, okay, I did 3 order sets this past year. Like, what am I on track for this year? So it just helps with like keeping yourself organized. And then, okay, I have this many learners. So I took 2 PGY2 residents and I took 2 learners this past year. I felt like that was like doable. I felt like I could handle that. And so that was, really a good way that I found to keep myself organized, to prevent myself from burning out and not being too overwhelmed with everything that was kind of coming my way as like the to-go person. And so before we get to the take-home points, I really just want to go back to some of the things that we identified as like potential challenges or concerns in the beginning. So can somebody share one potential thing that they can incorporate or that they do to make sure that they're taking more seriously or that they have that level of confidence? Does anyone remember something that we may have talked about or an idea to ensure that you have that confidence going into precepting somebody that's either older than you or your age or that you know from pharmacy school? Yes.
Like reviewing notes or journal articles or things that you collected during your residency to get a fresh look at it before you go into that experience.
Yep, exactly. So just, yeah, making sure that, if you need to refresh on a disease state because you haven't talked about it in a while, just looking back through what you accumulated throughout residency training. Did you have another comment?
Also, just understanding that you can still have like a friendly relationship. It doesn't need to be like super like separated. So just still having like that professional relationship as well.
Yeah, absolutely. I think, yeah, it's a fine line. You obviously want to remain professional with your learners and have that trust with them. But I think it's okay to, be real with them, be a human, show them that you're not a pharmacist robot and that you can, you have other things going on in your life. And I feel like the residents or learners that do the best are the ones that do have those relationships with their preceptors because they feel like they can be honest and open with them when doing that. Yeah, being a hard preceptor. Yeah, I think we're kind of creation of what we experience throughout training and learning. And so I've taken a lot of little things that I've learned from preceptors, and I like how this one organized their schedule. I like how this one did their time management. And so you don't have to just do one precepting style. There's a whole slew of precepting styles, which is like another presentation in and of itself. And just take those and make sure, and then have those like checks, like, hey, like you heard that, you happened to be in the office when I was like having that pretty serious conversation with the learner and giving tough feedback. Do you think I gave that feedback well, or would you have said things differently? Like that's how you grow, just kind of hearing and getting that feedback and having that open conversation. Feedback, knowing the learner well, learning more familiar with the environment. Yeah, so like I cover adult codes sometimes in the evening, and the residents will be on those, like we'll come to them and I'll be like, hey, like I don't know where this is in the hospital because I only work in the PTD. Like I've never done rotations here. I don't know where the CICU is or whatever and stuff like this. So just being honest with them, be like, hey, I'm on my way, but I might be a little bit late, or like if you get there before me, I'll be there shortly, just because like I don't know where that unit is. I have to get someone to show me where it is. So like I'm not gonna lie and pretend like, oh, I know where the unit is and whatever. So just being honest in that regard. And then schedule, really just making sure that you ask your coworkers, get examples, and then make it your own, depending on what works best for you. So what I want to leave you all with is some take-home points. So in order to be a great preceptor, whether you're a new preceptor, an old preceptor, you're at a new hospital, you have to establish yourself as a clinician first. So you have to be integrated into the medical team, and have that rapport with everybody, or else that learner is going to not have a great experience, because they're not really going to understand where you fit into that team and what their role is. So I always tell my learners that they should be an extension of me and like be serving in my role by the end. So if that's unclear to them, then that's going to be challenging to have that expectation for them if you don't have that established in your role yet. Know your limits and strengths. So just really know what you can handle, what you can't handle. After 2 years of training, 1 year of training, you'll probably have a good idea about where your time management skills sit, where your organizational skills are. So just, know what you're really good at, know what you need to work on, and seek out, preceptor development, talk to coworkers, get that feedback. And then lastly, just be honest with yourself. And I think, this really kind of just sums up everything. So where you are as a clinician, where you are as a preceptor, and you're really the only one who knows that, to the core. And so be honest with yourself, know where you have to improve, if it's on topic discussions, if it's with giving feedback, if it's with being, careful with like how you like speak to the resident, or a personal boundary with them. Just know where you're at with your weaknesses and your strengths, and be honest with yourself. And I think that will allow you to continue to grow and be a great preceptor. So with that, I would be happy to take any questions on being a new preceptor or being a new clinician, or a combination of both that anybody has. Yes.
As a new pharmacist or a new preceptor, have you ever run into this circumstance where you've had to say no to something, or how would you approach saying no to something when you're new and you want to make that good impression in your new workplace, or not let anybody down?
Yeah.
You seem really good at managing everything, but if you had to say, I don't think I can take that on right now, how would you approach that situation?
Yeah, absolutely. So I've definitely had that happen, actually from like the physician standpoint. So there's 8 PZD attendings, and so all of them are working on their own little things, and so they'll come to me with things. And so I did have one that I actually had to say, like, I don't have time like this month she was asking me to like pull how much ketamine we use in the emergency department, and based on our waste, if we're having that. And I said to her, I don't have time this month, but I'll have a learner next month, and that will be a great opportunity for them to get experience with like data collection and looking at that. And so I was like, if this can wait, then that would be perfect. And she was totally fine with that. So just kind of getting creative and figuring out, okay, this is something that definitely needs to get done, but like, where does it fall? And like, can I put it off for a little bit? I like to use the word triage because I'm in the emergency department, but like just triage, like from head to toe, right? Like when I started, I was like, this is all my like low hanging fruit. And these are things that like I want to accomplish by like 3 years in practice or 4 years in practice. Like I'd love to have this order set one day or this practice change. And so just triaging and really knowing that you don't have 1 year like you did in residency training or fellowship training to get everything done. Cause that's what I was struggling with too. I was in this mindset of like, this all needs to get done in a year. But that's not true anymore. Like hopefully you're in your job and you love it and you're there for a while and you can work on these things. You don't want things to go too long, but just having that balance. So yeah, definitely have had to say no and figure out ways to like not let somebody down and not lose that trust. So great question. Yes.
I guess on the same vein, like, how do you develop your schedule so that it's only 80% full? Like, how do you manage kind of like your limit without getting to that breaking point?
Yeah, that's a great question. So one example that I can think of is like my committee involvement. And so when I first started out, I was just sitting on one committee because a lot of times projects come from committees because they're interdisciplinary. So it's like, oh, we need this guideline or whatever. And so I started out on our like quality assurance committee in the emergency department. And once I got a feel for like what that is going to look like and what my responsibilities were, then I started adding on more. So then I started adding like the resus committee where we review all of our resuscitations, med safety, things like that, our sepsis committee for the emergency department. So I think that just making sure you don't bite off too much all at once in the beginning is really how you kind of prevent yourself from being like too overloaded. And just what I did was I was like, after the first month or two, I was like, wow, these are all the things I want to do. And I just wrote them all out. And then I figured out where do these like fit into a timeline of getting them done. So I think, yeah, going back to that like word triage, just like triaging everything, but then also like not going out and like taking on too much up front. And then once you get comfortable, I'm like, okay, I've been on this committee for 3 months. I have a good idea of how much work and time it's going to be. I can add on another one on top of that. So, and just knowing like, you know, with learners, like, can I handle 2 learners? Can I handle 1 learner? So like me personally, like space is an issue in my unit. And so I think it'd be really hard to have 2 learners just because of that. Big proponent of layered learning, but like, I think that is just an issue. So just knowing how much you can take at that time or like the time of year. So the summer in the ED is very slow because kids are out of school. So like, I really want to ramp up and get projects done, order sets done, presentations, guidelines, things like that. So whereas when the fall hits and we start getting respiratory season again, I'm not going to have as much time to work on those projects. So yeah. Any other questions? All right. Thank you everyone for your attention, and I hope everyone has a great rest of the day.